Dr. Todd Ellerin, once again, Director of Infectious Diseases at South Shore Health. Doctor, we always appreciate your insight and you joining us. We truly do. Let's talk about the state releasing those new requirements for child care centers, day camps. But even with these smaller groups and with face masks, do you think it's going to be difficult to reduce the spread of any potential virus in that age group?
I mean, I do, Maria. Obviously, this age group, it's more challenging. Oftentimes, they're asymptomatic, as we know even adults can be, and the signs of infection can be more subtle. So I think it's even more important that we follow basic infection control principles, cleaning our hands. At camps, we talked about trying to cohort kids into smaller groups with a dedicated counselor so they're not mixing. But I do think, again, these are children, and children tend to do much better with this virus. So I'm optimistic.
Well, that's good to know. But what do we know about the symptoms of COVID-19 in children?
Yeah, Ed, so, the good news is that the symptoms in kids are very similar to the symptoms in adults. So, first of all, many kids are asymptomatic like adults. Also fevers, dry cough, sore throat as well. Of course, we've heard about that mysterious inflammatory syndrome. Right. That seems to be more likely in kids, but still rare.
Any extra precautions that parents should try to take if they're going to send their children to a summer example, like pack their own lunches or drive both ways instead of them taking the bus? Any recommendations on that?
Yeah, well, I think with busing, you want to know, are there going to be multiple kids per seat? If there's one kid per seat, if you can open the windows for better ventilation, I think that's a good thing. Otherwise, you could drive. And I think packing a lunch may make sense. Although, again, I think if when the kids are eating, hopefully they're not sharing food or drinks with other kids, and perhaps physical distancing will help.
Yeah, but they're dark. They're kids dark. You know what I mean? They're going to share potato chips, or they're going to share cookies. I mean, that happens, right?
It's true, and fortunately, they're also a less vulnerable group. But we do have to make sure when they come home to their parents or grandparents or friends, we want to make sure that those people are not having chronic conditions. Right. Otherwise, we need to do more physical spacing.
So as we've been reporting, in Boston right now, more people are starting to gather for another protest against police, the treatment of minorities. We had the big event in Boston. People ignored social distancing completely. There were a lot of masks, I will say, but still, nonetheless, they ignored the social distancing. So how concerned are you that these group demonstrations will cause a second spike in coronavirus cases?
I'm really concerned. This is such a challenging time. We haven't seen a virus like this in 100 years, and we haven't seen protests like this since the MLK, 50 years ago. So the combination of this, I think, crowds and COVID can be very dangerous. I think it's important if you're protesting, you want to do it as safely as possible.
Doctor, thank you so much for your expertise and your time. We greatly appreciate it.
Thanks, you, Doctor.